Hey everyone, and welcome to another new episode of Escapist Corner. My name is Richard. You can find me at Richard Long, at Richard Long on Instagram and most platforms. And Escapist CrossFit on YouTube everywhere. You will probably find us. Did you know that most Germans pay around 250 euros per week for their health? They just don't get healthier from it, and I see that might be a problem. How this works is that every working person in Germany is demanded and has to pay into the health system. If you're an independent worker, it's a bit different, but if you're an employee, you don't have any other option really, so you will have to pay in about roughly 800 to 1,000 euros a month, and that it doesn't matter if you're sick or if you're healthy, you just will need to pay this sum. Now this is obviously sometimes buried in pay slips, so you don't actually think about it, you don't feel like you're paying it from your wallet, but you are. And to have this very honest, then it would be really nice for everyone to just get that into their pay slip or into their wallet and then have to pay it. Then we would start to question how we would use that. And this is like maybe a bit uncomfortable for some people. I understand that, and I'm not arguing that we don't need any healthcare system, but we're gonna get to what effect we are looking for here. So most people obviously get sick over time. It doesn't happen overnight. 80% of all healthcare costs are chronic diseases and lifestyle costs. So it has been something that has accumulated for many years, and that becomes the root cause of most of the healthcare expenses. At the same time, we have about roughly 10% of the population, 8 to 10 million, that have a gym membership. And the average gym goer actually only goes a couple of times per year, so hardly uses it. And this is also obviously where people feel that they are investing in their health, in their fitness, but they're actually not getting fitter. And this is why chronic disease just continues to rise year after year. One of those is diabetes. And from a population point of view, it's about 10% that they say are in diabetes. But if we would look a bit deeper, the estimate is about 60 to 70% are already pre-diabetic. And this number just continues to go up because we sit more, we move less, and we are eating more and more processed foods. And this action leads to more, healthcare costs. And healthcare costs is one of the biggest emissions of greenhouse gases, for example. It's 17% of the greenhouse gases in Germany. So what do we want to do? Or what do we do right now? Well, right now we prescribe pills. So we wait until we have pain. We start prescribing pills for a while, and then that takes away maybe some of the acute effects. After a while, the pills doesn't really work. We create stuff like Ozempic, where we give people injections to stop eating, which leads to loss of muscle mass, bone density. And now we need to create new medications to hinder the side effects of that. We know that one of the strongest data points for longevity and independence is muscle mass and bone density. There's a crazy statistic that if you're over 65, you fall down and you break your arm or you break your leg, it's about 80% probability that you will die within 1 year. And why would some people break their legs? Well, sometimes it's often is an accident, but many times it has to do with that the bone density is simply so bad, and bones snap when they are weak. So let's imagine this instead. Let's say we would invest 50% of what we do right now, not on on prevention instead, not on repair, but on prevention. And what would we see there? Well, if we would invest in structured training, nutrition education, if we would do sleep and recovery, and we would invest in that kind of coaching, I think the impact would be massive. We would have fewer sick days. We would have lower healthcare costs. They would drop dramatically. The sick day costs that cost us billions and billions for every year, those would dramatically drop. We would have lower greenhouse gases and emissions. We would have more independent people, because what happens when people feel better, then they have more confidence and so on. They get more independent. They start to do more stuff. They start to help other people more. And it doesn't come from medication. Like, independence doesn't come from medication. It comes from having work capacity. I know some people cringe or feel that as sometimes like this life optimization, yada yada, like, yeah, work capacity here and there. But what is work capacity? I'm not talking about like sitting more hours at the office. Work capacity is the ability to move your body. It's to carry. It's a ability to handle stress. It is to be able to recover, and it's also to contribute. Again, like if you are sick, you will not be able to help other people. That is just a base fact. The healthier people are, the more they can help other people. And you cannot outsource that to anyone else. You cannot outsource that to medical innovation and pills. A society doesn't get stronger by just treating weakness. It gets stronger by building actual strength and work capacity. So this is just a thought provocation for today, and I just want to see if we can think about this a bit differently, how we want to use the resources we have. I'm prone to do that every day. I need to look into the resources every day and how to use them, not only from a work capacity point of view, but from when you run a gym, that becomes a thing. You need to look into staff performance. You need to look into your own performance. And you have limited resources, and you want to use them in the most beneficial way. And I could not see a bit more beneficial way than to work preventively, than to try to treat symptoms. I hope this episode made you think, and if it made you think, maybe you want to save it. If it made you a bit uncomfortable, feel free to share it. If you think I'm totally wrong, then feel free to comment. Let me know. Anyways, it might be a sign that it matters. And I hope you can bring something back from this one. Okay. Wherever you listen to this, if it's on Spotify, YouTube, iTunes, and so on, feel free to subscribe, and yeah, give me a comment. That helps me keep motivated, keeping doing these things. Okay, until next time, have a good time. Bye.